In this video, we will discuss about the pancreatic cancer treatment ideas. And one of the ideas that is shown in this figure is about the adjuvants that are usually added to the vaccines to increase the immune efficiency against the tumor cells. So the adjuvants that this figure talks about is this TLR agonist and this STING agonist. And this both of these agonists, when are added to the vaccine and vaccine is injected into the patient, this TLR agonist will interact with the TLR receptors and STING agonist will interact with the STING receptors that are usually found in the mature dendritic cells. And because of this, when the STING receptors leads to the activation of the C-gas signaling pathway, and this toll-like receptors also leads to the downstream signaling pathways activations in the immature dendritic cells that will lead to the release of the pro-inflammatory cytokines such as type 1 interferon. And these pro-inflammatory cytokines will further lead to the activations of the other immune cells, such as it will activate or mature the immature dendritic cells, and also this it will help in the activation of effector T cells and the NK cells activations. And these activated immune cells will then be ready to identify will then ready to attack the tumor cells that are present within the patients. So, and the next therapy that are presently under study is the oncolytic viral therapy can be used against the pancreatic cancer. In this case, what will happen? This oncolytic virus or the armed oncolytic virus will be used. The difference between this oncolytic virus and the armed oncolytic virus is that in the case of armed oncolytic virus, the genome is modified in a way that it will take care of the immune suppressions that are usually found in the tumor cells. And also the another property of this oncolytic virus is that they can only replicate where there is oncologic pathways are activated, and also this interferon pathways are deactivated or disrupted, and both of these properties are usually found in the tumor cells and are unique to the tumor cells. So when this oncolytic virus enters into the normal cells, since this in the normal cells there is no oncogenic pathways is activated and interferons pathways are also not disrupted, so there the replications of this oncolytic virus will not happen, and it will lead to the viral clearance, and the normal cells will remain unaffected. However, when this oncolytic virus enters into the tumor cells, because of the oncogenic pathways are activated in the tumor cells and also interferon pathways are dysregulated, it will lead to the replications of the virus, and that will cause the lysis of the tumor cells. The lysis of the tumor cells, two ways lysis of the tumor cells will affect in two ways. First one, this uh, replicated virus will infect the other tumor cells within the tumor microenvironment, and thereby that leads to the cascade effect of lysing of the tumor cells. And other things is that the dying tumor cells will be taken up by the antigen presenting cells, and the antigens and the epitopes of this dying tumor cell, unique epitopes of the dying tumor cells will cause T cells activation or T cell priming, and this will this will lead to the generation of the T cells against the unique epitope that are found on the tumor cells. So then these T cells will again be transported towards the primary tumor cells, such as in the liver, in the pancreas, and also to the metastatic tumors, potential metastatic tumors locations such as the liver or lungs, and thereby the immune systems of the host will get trained to attack the tumor cells that are found across the body that are generated by the pancreatic tumor cells that has since all of those has the same epitopes. So in this way, the oncolytic viral therapy can remain unaffected towards normal cells. However, it will activate not only the immune cells, but it will also enhance its It will also help in lysing the tumor cells on its own because of the viral replications. And it will because when the tumor cells are lysis, they will release some of the PAM, STAMs, and tumor antigens that have been detected by the antigen presenting cells. That helps in this host immune cells activations against the tumor cells, and which are being prevented because of tumor microenvironment that acts as a physical barrier for these immune cells to detect the antigens that are unique epitopes or antigens that are present on the tumor cells. However, when the tumor cells are lysed, these antigens are released and being easily detected by the antigen presenting cells. Thus, the oncogenic pathways works not only on its own towards lysing the tumor cells, but it will also help in enhancing the immune response. So these are some of the ideas on which pancreatic tumor, some of the ideas by which pancreatic tumor cells diagnosis can be improved. If you need to understand more about these ideas and uh, other ideas towards treating these pancreatic tumors, you can go through the reference that has been provided in the description. That's all for this video. Thank you for your time.